Hey, Dr. Laura. So yes, this is exciting. Welcome to the Freedom Force Battalion.
Thank you so much, Melissa, for having us here. I'm so excited to be here and to be sharing this wonderful news with everybody.
Yes. Okay. So, we've got so much to tell, but Iva is going to go first, and make sure you're close enough to the mic. Okay, Laura. And so tell us the story of Iva.
So Miss Iva came from all the way from Louisiana, and her journey has been amazing. She started having pain since she was a teenager, and it's been a while since she hasn't been able to have any relief. I'm gonna let her tell us her story, because I think I'm not gonna do a great job like she will. But I just want to say I'm so encouraged and so happy for everything that has been happening. And Prescribing Life has make a big impact in her life, and she has make a big impact in my life too. But what's more important is because of you all, because she is part of the donation program that Melissa started. So this is all because of you all, and I want to let Miss Iva tell you all what's been happening with her.
Yes. Welcome, Iva.
Well, first of all, thank you for having me, and thank you so much for the donation program. I mean, it's such a blessing because I'm retired. I would have never been able to get all this done without that. So bless you and Dr. Laura both, for contributing to my health.
Yes. You're gonna make me cry. Don't talk about that, because you make me cry when you do. So for those of you who don't know, Laura is the one who helped my mom when she was on 3 opioids a day and in such excruciating pain she couldn't even stand up for 5 minutes. And so we found Dr. Laura, and she's helped my mom. My mom is totally off of any pain medication now. Such a miracle. So I started sharing this on the show. If you haven't seen it, go to the health page, freedomforce.live/health. And then we did say, hey, if there are people who need this terribly, but maybe don't have the insurance or the health savings or whatever to do this, and so who wants to help support this? So this is our first one. We accumulated some funds, and they went straight to Iva, and I'm so thankful that this has helped you. So continue with your story.
Well, do you want me to start with
when you were a kid? You say you had a car accident.
When I was 18, I was in an automobile accident, and someone else was driving. I got thrown out of the car, and one pelvis had one complete break and several fractures, and the other pelvis had 27 fractures. And you can't do anything about that except lay and it heals. And they wasn't even sure if I'd ever walk again. And ultimately, just from that one problem, everything settles as you get older, and it affects other things in your body. And so my whole spine and neck, everything has been affected through the years. And then I fell off of a ladder about 8 foot high onto a cement and broke my back. I did not have insurance, so I just wore a cinch type belt and healed. And so I've had a lot of pain in my back from that. But I have lots of other things. My knees, they say, are bone on bone, and they would hurt, and they don't hurt anymore.
Oh, that's so great.
And I just drove by myself to Kansas last week and came back, and I normally would be in pain from that and exhausted, and I'm not hurting at all any place.
Wow. So
a few things.
Fast forward to, so you've been watching the Freedom Force Battalion. You heard my story about my mom, right?
Yes, ma'am.
And then I said, okay, whoever would like to, participate, go on to Prescribing Life, and then you found out about the donation program, and so you talked with Laura, and you were the first recipient. All right, so then I think one of your buddies drove you over, because at that point you were not able to drive, right?
Well, I could drive, but it was, it hurt. My hips would hurt really bad to drive a long ways.
Right. So tell me then, so you went to see Laura, and what happened?
Well, all I can say is your pain goes away.
Okay. End of story.
But it's not invasive at all. And what she does is it's not like shots down deep in your body like you think, and and she's so patient and kind, and just the sweetest thing. But she knows what she's doing, and she knows right where to put the medicine.
Right. And it just goes, you're right. It just goes right just underneath, subcutaneous, just right underneath the skin. And so for those of you who haven't seen the other videos, basically she's going to your scar tissue, and it's causing the scar tissue to what do you call it? Lose all this inflammation, to shrink. And so it doesn't send the pain signals. Am I right, Laura?
Absolutely, Melissa. One of the most important things that we do is to diminish inflammation, and we also help the scar tissue to recover, because remember that when we talk about scar tissue, we always think about, the external scar tissue, but every time there is any kind of trauma, like a car accident or falling from, like 8 feet staircase and
ladder,
thank you. So all these kind of issues that create internal scar tissue as well. The main problem with that is that just like your external scar tissue starts creating a tightness in certain areas, that is happening inside as well. So most of those nerves and most of the arteries and veins in those areas are entrapped. That's called nerve entrapment. And that causes pain, but it also doesn't allow a correct blood flow in those areas. So creates even more inflammation. So what we do in Prescribing Life, we help to reduce all those things. And over time, we start seeing excellent results. We have been working with Iva for less than, how long? 3 months. And she's having excellent results. So I'm so happy for her.
Yes, that's amazing. It is. It's really, it's they act like when you go to the hospital, or to the doctor, you've got to take this drug and it makes you all loopy, or you've got to do some kind of, we're going to have to cut you more, bring out the scalpel, and that's really amazingly not needed in at least in the cases where, for my mom and now for Iva, and I think for Elizabeth too, we'll get to Elizabeth, that it's just really shocking that it's that simple, but you're just treating those nerves. And I think of it as, now I could be wrong. Okay. If I'm wrong, okay, just say, oh, you're wrong, Melissa. But I think that the nerves get atrophied or hardened or something, so that they're not able to send the signal. And so, I don't know, send it right. Anyway, so if we just need, I know, like you've done my finger where I cut my finger, and it's like reviving the nerves somehow. So making the nerves where they act like they should. That doesn't sound like a doctor saying it, but say it like a doctor should.
That is a way to say it, Melissa, because definitely what we're doing is activating the nervous system, and in many areas of our body, when we have, again, any kind of traumas, that nervous system is not working correctly. So what we're doing is sending the proper messages. And when there is pain, then there is not the need of having pain anymore. When there is numbness, then the numbness goes away. But also, motility, the atrophy goes away. The muscles start responding in a better way. Contraction starts happening. So we tend to forget that everything really in our body is connected, and the nervous system is this network of information that is sending and receiving messages everywhere and telling us what to do. Just like when you're thinking, I'm going to raise my hand, and if I'm able to, I will do it, right? So that's happening all the time in our body, and It is controlled through that. So when we are able to send the right messages, we're going to get the right response.
Right. Yep. Make it do right. Right.
But
Go ahead, Ira.
I wanted to say also that my doctor had me going to a pain management doctor, and I had a lot of shots in my lower back, and they didn't even faze me. By the time the numbness went away from the anesthetic and everything, it was like I'd not had the shots. And
Yeah,
so
my mom too. My mom too.
Yeah.
Yeah.
Well, they told me the only thing else that they could do was operate on my back. And I told them, as long as I can walk, you're not going to operate on my back,
Right.
And so they gave me some really strong pain medicine. And I mean, I might take one every 3 or 4 months or something, I don't anymore, but I know that it's addictive, and I didn't want to take something addictive. So I would just put up with the pain, but I don't take anything for pain anymore, so.
That's awesome. That is so wonderful. I'm so thankful. No pain medicine at all.
No.
Don't need it.
No.
Don't need it. And so your quality of life, now you're, like you said, driving to Kansas, doing whatever you want to do. You have your life back.
Right.
That is wonderful. That is so exciting. So yeah, is there anything else that you wanted to share with everyone?
No, I
That was your story.
just want to thank everyone for supporting Dr. Laura and helping me out.
Yes. So yeah, I definitely, I haven't really talked about that lately, but I think this is a very worthy cause because, maybe to look at you look fine, you look wonderful, but inside you were hurting so much, and it really, affected your quality of life. And so, to know that we have able to, for those of us who are not in that type of situation, with just few little paper bills, we put them, and then they can restore your life. It's our privilege and honor to be able to participate. And the great thing is, each one of us can do a little thing like $5 or $10 and have an effect like this. Very, very exciting. Our goal is to be like Jesus and to go and just, everybody's healed. Okay. We're going to have a big party, right? Everybody's going to be well. So yes. So I'm so glad to know you, Iva. That's so wonderful.